So good afternoon, everybody. In this session, we're hoping to tell you a little bit about what you need to know to get your clinic started on CII and CPAR, which are the technologies for integration and continuity in Alberta. If you don't mind, please stay on mute until you want to ask a question, but please feel free to put questions in the chat as well. I think we're all becoming kind of experts on Zoom, but if you are newish to Zoom or you haven't played with it too much, this is just a quick reference, just shows you where to click to mute your audio, how to stop your video, how to look at the chat, and how to give us thumbs up or clap or whatever. And please do feel free to use the chat at any time. You will have had to click a button to say, please allow for recording. So just note that we are recording, of course, and by participating and by clicking that button, you are consenting to being recorded. And you're also consenting to the webinar being made available on the AMA ACTT YouTube channel. The Q&A or the chat actually is not visible in the recording, but any conversation we have, of course, is part of the recording. So just so you're aware that is happening. And as well, we're going to do a little activity later on in the session. So we're going to use annotate, and how you get there is if you go up to the top of your screen, there's a view options area. If you click on that and click on annotate, this toolbar comes up, and you can use the text or a stamp or whatever you choose there. And we'll review that when we get to the annotate page as well, just in case you have not used that before. So I am Angèle Heinzman. I'm a consultant with the Accelerating Change Transformation team at the Alberta Medical Association. My colleague Sheena is with me today. She's the provincial PCN lead for CII and CPAR. And we also have Kendall Olson here today. He's going to wave at you. He is our chat monitor, and he's going to make sure that we answer all the questions and also put lots of useful information into the chat for you as you go along. So without further ado, how do CII and CPAR fit into the provincial landscape? Well, I wanted to show you a simple view, or as simple as we can make it, a view of eHealth in Alberta. So hopefully most of you are familiar with Netcare. That's the provincial electronic health record that collects information mainly from AHS systems, but from other areas as well. And there's also ConnectCare, which is the common clinical information system that is being implemented within AHS facilities. It's bringing 1,300 different systems into one. And whenever I say that, I always feel like that is a huge number of information systems. So understandably, it's going to take a few years for that whole rollout of ConnectCare to happen. So some of you may have seen some ConnectCare movement in your area, and some of you, this might be the first time hearing about it. But those two systems do actually communicate with each other. So there's a little bit of information that goes from, well, there's quite a lot of information that goes from ConnectCare into Netcare at present. But by contrast, over in the left-hand corner here, you have all of the EMRs in the community sitting separate from the information systems, Netcare and ConnectCare. And really, without CII and CPAR, the only connection between those systems is e-delivery of lab test results and diagnostic imaging that comes through into your EMR. But that's a one-way flow of information. So CII actually sets up community information integration, sets up that two-way bi-directional flow between community EMRs, like in your clinics, into Netcare. So that's the way that that information is going to be integrated into Netcare. And similarly, the Central Patient Attachment Registry uses that CII wrapper around Netcare to transmit and use information that's really useful to integration and continuity. There's also the Central Patient Attachment Registry's connection to Netcare also enables e-notifications about the paneled patients in your practice. There's also the healthcare data repository. So some of the information that goes into CII is captured in a data repository that's used for provincial planning and sort of statistical analysis across the province, but that's at a very early stage at this point and not really being used for anything at the moment. And also my health record. So you might have used my health record yourselves. It's a way of looking at your own information as a patient, anything that's in NetCare. Well, not anything, but some stuff that's in NetCare. And there are lots of improvements that are being made to my health records in terms of what information is shared with patients. So the other important thing to know about CII and CPAR in terms of that information landscape across the province is that they were actually requested by physicians. So the section of general practice, as it was known now, section of family medicine, they did request the central patient attachment registry. And similarly, Alberta's community specialists also wanted to be able to use technology to get their reports, their consult reports onto NetCare. So that's where CII was born. And all of these motions were happening in around 2016, and then in 2018 they were agreed amongst all the partners that you see at the bottom of the slide to combine into one project. But so why is CII important? I've kind of talked through a few reasons why it's important, but it's also important to remember that there's a two-way flow of information. And so you remember those little arrows going back and forth between the EMR and NetCare. It's actually a two-way flow, and that is a critical piece here. So there's information shared from your EMR. So that would be confirmed panels, patient encounter data, and also consult reports where that's appropriate. And then there's information received, and that includes e-notifications, panel conflict reports, and demographic mismatch reports. And we're going to talk about those in a little bit more detail in a moment. And the e-notifications really are one of the really big value propositions of this whole system, but we'll cover that in a few minutes. And then there's also some changes to NetCare. So this third box here, there's actually enhanced information available in NetCare as a result of CII and CPAR, and that includes the community encounter digests, which we'll look at in a little bit more detail, and consult reports if they're being prepared by your physicians. And in the future, we're going to also be able to see the primary provider within NetCare for a patient, and patient summaries are hopefully coming in the future. So those are more about patients who have a complex situation, just to provide that snapshot of information about the patient when they are visiting other parts of the health system. So as I've kind of alluded to here, there's a few different options for community-based physicians. So family physicians and pediatricians can have panels, or they can operate without panels. For example, physicians who are purely doing walk-in, family physicians who do walk-in care, and they don't have regular ongoing relationships with those patients, they would not have a panel, but many family physicians do have panels. Pediatricians sometimes have panels, and sometimes they're mostly doing consult type work. Whereas other specialists in the system are mostly doing consult type work and encounters. Excuse me. So family physicians and pediatricians have the options to do encounters. They have the option to submit panels and receive e-notifications, and they may also be submitting consult reports if they're doing some consult work as well. Pediatricians, very similar. If they do have panels, they can upload those panels just like family medicine. Whereas all other specialists are involved in CII mainly with encounters and consult reports only, because they don't have panels. So this is the community encounter digest. So basically, for each patient, there is a CED, community encounter digest, which assembles kind of a record of all the visits across providers that are participating in CII. So it's kind of a rolling snapshot of encounters that the patients had in CII and CPAR enabled clinics over the last 12 months. So what it looks like is the top section here has those community encounter information pieces with, where they sought care, what they sought care for. The health concern history, so that's if during the visit something was listed in a problem record. There's possible allergies section. There's also a section for metrics. So this is things like measured observations like the blood pressure, height, weight, etc. And those are come into CII or CED if they are put in the right part of the EMR. So if you've measured BP and you've just put that in the SOAP notes, it won't appear on the CED. But if it's in the blood pressure field, then it will flow into this community encounter digest. Any immunizations that are given in the visit, that is available here, and also referrals. There's also a disclosure message at the end that just says that this document lists patient encounter information from participating clinics. So if a clinic is not participating in CII and CPAR, they will not appear in the community encounter digest. So you can see why we are really keen to get all providers up on the system. And there's a lot of concern out there, completely understandable concern about sensitive diagnoses, for example. So there are confidentiality features within every EMR, and there are loads of resources on our website, on the act.albertadoctors.org website, some of which has been shown to you in the chat by Kendall already. But any information that's in an unmapped field is not going to leave the EMR. And then there's that additional confidentiality functionality. So there is information that can flow and information that cannot flow, depending on how you want that to work. This is also another reason why it's important to have the health collection poster up in your clinic. So we have some samples of that on our website as well, if you don't already have one. Because it just makes a lot more sense to understand exactly what's happening with your information as a patient. So I wanted to turn to a patient story, and it's related to the Community Encounter Digest. So this is a story from the North Zone. So Dr. Ojedikin is a physician champion in the North Zone. And thanks to CII and CPAR, he receives notifications directly in his EMR, similar to a lab result, when any of his patients are admitted or discharged from hospital, have an ED visit, or are discharged from ED, in fact, or have day surgery. So after going live on CII CPAR, one of Dr. Ojedikin's patients was admitted to hospital with a hemorrhagic stroke. And following surgery, hospital staff had found that her blood pressure was really high, and they kept her in the ICU trying to determine the cause. So CII CPAR enabled the patient's attending physician in the hospital to see in NetCare that Dr. Ojedikin had provided care to the patient over the past year. So that was in the Community Encounter Digest. They saw the name a number of times. So that meant that the attending physician was able to contact Dr. Ojedikin, and because they assumed that as the patient's primary care physician, that he would have key health information about that patient. So Dr. Ojedikin was actually able to let the attending physician know that the patient was actually an active crystal meth user. And the reason why that wasn't available in NetCare was because he'd used that confidentiality functionality that I mentioned. So as soon as Dr. Ojedikin told them that the patient was using meth, the attending physician was able to change the treatment plan, change the medications, and able to stabilize her. So if they hadn't seen that CED to find out, which physicians had been interacting with this patient, they wouldn't have been able to stabilize her. So I mentioned earlier that there are some reports that are available for download. So this first one that I'm showing you on the screen is a demographic mismatch report. And the important pieces of information that you get here are any patients that are now listed as deceased in the provincial client registry, but also where patients have demographic data that is different from the registry. So for example, if you registered in for your Alberta Health as Kimberly, but you are down in the EMR as Kim, it will flag that up. And really, that's probably not an important change to make, but things like if you've in the EMR, excuse me, if the date of birth, the day and month have been reversed, or there's a spelling mistake in one of the names, that can help correct those. So it's really helpful for keeping your panel clean and keeping that information up to date. There's also a conflict report. So basically what this shows is any patients that are paneled to more than one participating provider. So the providers that are participating in CPAR will be compared within the database, and it also compares the date of confirmation. So the last time you confirmed that Dr. X was their family doctor, and it also shows the date of the last visit for each provider the patient is paneled to. So you might be able to use these conflict reports, for example, to check whether a patient has moved. It might be obvious if the dates of last visit are quite long ago. But really, what this shows us is that it's super important to keep date stamping in the EMR when you confirm a patient's details. So why do you think it's important to manage panel conflicts? So it's quite important, particularly for patients who might have a complex or chronic condition, because it's quite possible to receive contradicting advice from two different physicians. For example, they may just have a different way of looking at that condition. They may also not be aware that you're being prescribed a medication somewhere else. It's also really important from a system perspective in terms of allocation of resources. So no clinic wants to duplicate the service that's already being provided by another clinic. So for example, being asked to book in for a pap test, for example, that can cause the patient time and stress, and it also causes the clinic cost and pressure. And also, of course, the overall health system, it makes resources more scarce if they're being used in two different places. So this is just a quick snapshot. We are going to share this slide deck with everybody who's attended today. So you don't need to worry too much about all of the information on here. And for sure, if you are working with the practice facilitator in a PCN, they can show you the information you need from this slide as to when panels are uploaded. So, but what this is showing is that, QHR, Curo system uploads the panels on the 12th of the month, TELUS uploads on the 10th, HealthQuest on the 21st. CPAR really starts looking at comparing those panels to each other from the 22nd of every month. So no uploads are made between the 22nd and the last day of the month. But what that means is that the panel conflict reports are available to you on the 2nd of the month. So I mentioned earlier e-notifications. So these are automated alerts that basically come in like a lab result, and this is what it looks like at a glance. That's an example from MedAccess, but they show notifications of discharge from an emergency department, hospital admissions, hospital discharges, and day surgery discharges for any AHS facility in Alberta. And most are connected at this point. There are probably a handful that are not, but so for most AHS facilities in Alberta. And these actually come 7 days a week, and they come at 6 a.m. and they come at 2 a.m. or 2 p.m. Sorry. So they're actually, pretty frequent, and really give a lot of great information to the physician. So this is actually from a perspective of one of our provincial physician champions, Dr. Heather Laborde. She thinks this is the most attractive feature of CII CPAR. So if you look at the slide, you've got a patient discharged from hospital, and you've got a family physician who's wondering what's going on with their patient. In the Calgary zone, because they were concerned about patients falling through the cracks, so patients being discharged and then not knowing that they were discharged, they started a fax-based process. So a discharge notification was generated, fax notice was sent to the physician, and then someone in the clinic would scan it in, and it would be available to the physician. However, when they joined CII and CPAR, there's now no manual intervention. So really, they have moved from a human-centered approach and a local solution to an automated provincial tool. So all of this information is coming in near real time, and it's not dependent upon when a human is available to fax the information, scan the information, etc. And the final piece of information that is available in the in NetCare from CII CPAR. So this is the fourth piece of information, because you've got e-notifications, you have those panel reports, and you also have the encounter digest. The final piece of information that you can see are these consult reports. So any physician who's providing consult services can upload their consults into NetCare. And every single consult, there is a choice as to whether to upload it or not. So again, when you have those sensitive conversations with patients or a particularly sensitive diagnosis, you don't have to send the consult report to NetCare. So there's a lot of there's a lot of interaction that can be made there and lots of decisions that can be made rather than just blanket sending everything to NetCare. So what is the current status of the project? Well, CII CPAR has only recently come out of pilot testing, and we're already over 1,000 physicians live. So this is as of March 3rd. And you can see that represents 830 family medicine or general practitioners that are either in progress or fully live, which is pretty great. So the other thing that we think is important about CII and CPAR is that it really helps improve transitions of care. So I don't know whether you've seen this graphic before from the home to hospital to home guideline that's come out recently, but I wanted to use this graphic to show you how CII CPAR interacts with that transitions of care work that you're all doing, and what benefits have come through the participation of providers in CII and CPAR. So for example, there's encounter data from over 265,000 unique patients that have come because of CII and CPAR. CPAR, has enabled over 12,000 e-notifications per month. Over 97,000 consult reports are now in NetCare because of CII. And finally, over 300,000 Albertans now have the opportunity for smoother transitions. And this data is all from late February of this year. So what do you need to get started? There's a number of prerequisites that I'm going to go through on this slide and a couple of subsequent slides. So the first one is pretty simple. Are you on a conformed EMR? So the conformed EMRs include HealthQuest, Accuro, MedAccess, PS Suite, and Wolf. If you're not on one of those conformed EMRs, then unfortunately at the moment you can't participate in CII and CPAR. However, there are some conversations about other EMRs that are ongoing. So watch this space, reach out to your practice facilitator or your AMA consultant, and we will be able to direct you to the right information. But if you're on one of those conformed EMRs, then great. That means that you can get started as soon as you like. The other prerequisite is being on the Alberta NetCare portal. And if you're not already on that, on NetCare, then there's lots of resources as well and links to get onto NetCare on our website. But more importantly and more that causes a little bit more concern for some clinics is the EMR privacy impact assessment. So I'll talk about that a little bit more in a moment. And then the final prerequisite is that the clinic should be panel ready. And I will explain that a little bit more in a subsequent slide. So let's talk a little bit about PIA. So there is a privacy impact assessment form on our website. So if you go through that self-assessment for the clinic with the EMR, you will find out whether you are pretty much up to date, whether there's like some changes that need to be made, whether they're low risk or higher risk. And if there's no changes that you need to make, you can move ahead straight away. And if there's just minor changes to be made, you can complete those while you are going live with CII and CPAR. If you've got more high risk changes, so some larger changes that haven't been implemented in your PIA, then you have to wait until you've submitted the PIA to get started. But what is nice is you don't have to wait for the Office of the Information Privacy Commissioner to approve and log and get all the paperwork done on there, and you can start the CII CPAR process once you've submitted those to OIPC. So that just eliminates a little bit of a bottleneck there. And it's also worth knowing that when you do complete the confirmation of participation form, which is the most important form we need from you, you will have a e-health consultant assigned to you and have up to 1 hour with a privacy consultant to walk you through some of those changes. So I talked about panel ready. So what does that really mean? Really, it's about having processes in place to identify and maintain your panel. So we do have a panel readiness checklist. And maintaining our panel is an ongoing process. It's never going to be 100% perfect, but it's really just about making sure that work is ongoing and that there is a panel process happening. So I'm going to hand over to Sheena, and she's going to talk to you now about what clinic managers need to know.
Thanks, Agile. Okay, so you've heard a lot of information. Angela has gone over what CII CPAR is and what it isn't, and most important, how information goes across the system, how clinics are sharing and receiving, and how that's enhancing what's already in NetCare today. So as a clinic manager, what do you really need to focus on? Now on the next slide, we are going to start with doing an activity. So part of the pre-work for this session was to go over the CII CPAR roles and responsibilities document. So I'm hoping most of you or all of you have reviewed that document. We're going to do a matching game. So what you see on the slide on the left-hand side are the roles in CII CPAR. So there's a practice facilitator, there's a site liaison, an access administrator for CPAR, then a panel administrator. You also have an AMA Act partner, and you have someone at eHealth Support Services. In the middle of the slide, we have 6 different responsibilities. Each of those responsibilities are associated with a role. So what I'd like you all to do now is play along. Go up to the view option screen as you see on our slide here, because we're going to do the annotate function. And I'd like you to select the text or a stamp. And we're going to start with the first responsibility. In that responsibility, write in or stamp which role you believe is appropriate. So let's start. So for number 1, whose role is it to be able to give users permissions for CPAR? This person also usually gives permissions for NetCare. If you can stick it in the box, the rectangle for number 1. And if you're struggling with the Go Annotate, feel free to also put it in the chat. So we're seeing lots of answers for the access administrator. So let's go to number 2. Whose role is it to be the main contact at the clinic during the implementation? Number 3, whose role is it to log into CPAR to download the reports? So this is downloading the conflict reports, the demographic mismatch reports. Whose role is it for number 4, Who receives the COP and starts the registration process? Who sends you all the forms to keep you moving along your journey? Number 5, who guides the clinic through their CII CPAR journey, starting right from the beginning at the interest phase? And our last one, who helps the PCN team plan the rollout in their PCN? So who helps them with figuring out which clinics should you engage first? Okay, good job, everyone. Let's clear the screen and let's review the answers. For number 1, oh, sorry, Angie, I don't think it's moving.
Yeah, it's not moving. Just give me a moment. Oh, I think I need to remove the annotate of my own. Anyway, sorry everybody for removing all of your great work there. There we go.
So number 1, all of you got this right. So the person who gives the users permissions for CPAR, so this is to get into the application. This is the access administrator. So similar to Netcare, CPAR also is a database. So it's getting access into the database. For number 2, we also all got this right. Your main contact is your site liaison. Now the site liaison quite typically is the clinic manager. So all of you here on the call today, so something to think about. This is the person who's the primary contact for all our partners in the project. For number 3, again, we saw all of you getting this right. Logging into the application. So not just the access, but getting in and physically downloading those reports. This is also the person, as this is correct, as the panel administrator, who often is also the one doing the conflict resolution. So working on those conflict reports to get those numbers down, cleaning up the panels with the demographic mismatches. So that's the panel administrator. For number 4, so this was interesting to see some of the responses. The actual answer of who's receiving the COP, now that's the eHealth Support Services team. So it's not the AMA ACT consultant and it's not the practice facilitator, it's the eHealth team. So as soon as that's who you're going to submit your first form, the COP, that's who receives it. And it is from them where you're going to get the additional forms. The forms, that's the administrative work. Truly, that's the bulk of the work for the CII CPAR program is to get the forms completed. So working with eHealth will be really key. For number 5, again, there is also a little bit of confusion here. Who your guide is your actual practice facilitator. They're guiding you throughout the whole process from beginning to end. How the ACT person works, and that is for number 6, that is helping the PCN, making sure your practice facilitators are trained. So Angel, in the last click, we can see that when you look at number 5 and 6, your guide for the process directly working with the clinic, that's your practice facilitator. The ones who are working with your practice facilitators to make sure that they are trained, they have the support that they need, that's your AMA partner. Okay, so let's move on to the next one. Now, if you went through that activity and you're thinking, okay, I don't have a clue and you didn't get a chance to review the roles and responsibilities document, don't worry, here's what it looks like, and here's the summary, and you have the link below, and I know Kendall has also included it in our chat. It's an important document. As a clinic manager, you really need to understand what the roles are, responsibilities, and how you're going to function within the clinic. But no, you're not alone. You really do have the support of your PCN behind you. You have the support of the eHealth team that's going to walk you through as soon as you submitted that COP. And there's always an ACT person who's behind the scenes helping directly with your PCNs as well. Now, thinking about the tools that you will need at the clinic level to make sure you're successful and confident when you're going through your CII CPAR journey. Your access administrators, make sure that they read and review the access administrator guide. It goes over what their responsibilities are in detail. So as people are changing out in your clinic and you're getting different panel administrators, for example, your access administrator is the one who's going to fill out the new forms or delete the access. Now, the CPAR panel administrator, the person actually going into the EMR, so you need to make sure they have EMR access, right? So they're going in, they're downloading those reports, they're pulling a panel list when you do the first panel upload, making sure that that quality assurance is done. Okay, what I see in my panel list is the same things, same number that I see in my CPAR, the CPAR database. That person really needs to make sure they go over the CPAR administrator guide. All the steps are in that guide. Even if there's errors that are coming once you've uploaded the information, they'll be able to look at the sample errors and how to make sure they can resolve them. So again, the documents are all on our ACT website. And these are the two key ones as a site liaison that it's important that you make sure your team, your AA and your PA are aware. So knowing that the roles and responsibilities are important, that we have a document and that we have the tools, let's hear from a physician. This is from the Edmonton zone, from Dr. Janet Craig. Now, when she reflected on her experience joining the CII program, she said the process was smooth, it was effortless. And really, it was smooth and effortless because she knew she had a team. This was not all physician work. She knew she had a team and she knew what their roles were within that team. So super important again, as a clinic manager, when you're thinking through how you're doing your rollout, which clinics you're approaching, making sure that you have the right site liaison. If it's not yourself, that's the right key person that's connected and that they're the ones that are doing that communication back and forth with eHealth, that your PCN practice facilitator is there to help you and make sure to fill out the forms, you're doing them correctly, and also to help you with that heavy lift afterwards when you're receiving the information. Your PCN PF and your panel manager could work closely together on those processes of how do you resolve those conflicts. And so you can understand how to bring in your physicians when you're looking at your panels and the information that's going up in the system, that their role then is part of that data quality. You're bringing them in at that point. But your eHealth consultant, again, they're going to walk you through as you're going through and filling out your forms and you're starting to share your data. So when you're thinking about the process from beginning to end, what are the tools that are available to you? We've got tools in many different formats because we know everyone likes to learn information in different ways. So on the screen, one of our tools is a clinic journey checklist. So this is end-to-end process, and it starts from the beginning, from just engaging your physicians, all the way to now you're sharing information, receiving information back. In that step document, there are links to the specific tools that will support you along the way. Now, not everyone likes a checklist. Some people like more visual tools, a flow map, and that's what you see in the center there. So you can see when the activities are happening and who's doing them. You would use your flow map. Now, there are other people here who prefer to actually have something that's more tangible in their hands. So we've taken that clinic journey checklist and put it into an Excel document in what we call a RACI. So it's a project management tool, a RACI, where the R talks about who's responsible to do the work in all the different phases. A is for who's accountable, who needs to make sure that the work actually gets done. And C is who's consulted. So who on your team needs to be kept in the loop when you're making some decisions and who would be informed. Maybe this is where the physicians are informed of when your clinic is going to go live. So that Excel document, it can be customized to your team. You can put different team members' names in there. But know that again, it follows the sequence. So it breaks it down into small chunks and you can follow it step by step. All of these tools are aligned. They're just presented to you in different formats. So when we think about the registration, what's most important is to know that the COP kicks it all off. That is your first form. So that's the confirmation of participation form. Now, when you're doing the COP, know that there's value in doing that PIA update self-assessment. And the reason we say that is that in that self-assessment, it will ask you questions about your PIA. So you can determine if it's minor or if it's a major update. But don't stress out, because even if you don't know the answers to that, still go through the questionnaire. I'll show you on the next slides where if you're not sure if your PIA update is up to date or not, it doesn't matter. But doing the assessment is important, because when you submit the COP, one of the first things that eHealth will do, remember, they are receiving the form, they're going through and checking the information. They're now going to attach a privacy consultant. And as Angela has mentioned, that's the opportunity for a free 1-hour risk assessment on your PIA. Now, part of that risk assessment is asking you the questions from that update self-assessment. So if you've gone through it and you confidently know your information, that's maybe a 10-minute phone call and away you go. Regardless, they're going to ask you the question. So it's just important to, as your preparation, to go through that. So the actual COP, so that's what we have on our slide here today. So on the left-hand side is a full form. What we're highlighting is certain sections. I'm not going to go in complete detail for the COP, but I want to highlight certain sections. In Part A, what's really important to remember is this COP is how PCNs can track which members in their clinics are participating in CII CPAR. So how that's tracked is eHealth, when they receive the COP, they're going to look at the clinic name and they're going to look at the PCN affiliation. So really important you put the right information here. And if you're not in a PCN, you can hit that drop down. There's also a none feature. So select the PCN you're in. If you're not in one, select none. This is how Alberta Health will start doing their CII CPAR progress reports, by looking at the COP, and start to create the report saying the number of physicians by PCN. Now, in Part B, Angela has talked to you about the readiness to participate in CII CPAR. On this form, as the site liaison, is where you're indicating to eHealth what your readiness looks like. So I've talked to you about that PIA update self-assessment. So it is right here on the form with a link. And there is an option to say you're not sure. Maybe someone in your team has gone through it, your privacy person, maybe they haven't. If that's the case, just say not sure. If you have a sense that it is a minor or major, let them know that. If you think there's no updates, let them know that. If you don't know, let them know that. Again, this is just to give them more information, because when you go through this process, the eHealth consultant will still validate this information with you. Same with the PIA date. It's okay if you don't know it. In Part C, again, the site liaison is completing this out. Super important that they're listing all the providers that are participating in the program. So in your clinic, you may start off with just one physician and one person from your multidisciplinary team, or it could be all your physicians or 2 physicians and no one from your multidisciplinary team. Whatever it is, wherever you're at, you're completing the COP. Whoever's participating in that point in time, list their names and list the information that they're willing to share. So their encounters, their panels, or if it's their consults. This is a section where eHealth is looking to ensure that you, as a site liaison, has made sure your clinic is aware of what data is shared and what isn't, and how to protect patient confidentiality. So as you go further in the form, that's why they ask you to initial that there is awareness within your clinic and team. So lots of details on the form. Instead of going through it all here, I highlighted certain sections. But know this, we have lots of tools available at your fingertips, so don't stress out on the details, because there's a whole video. It's 12.5 minutes that goes through from the top of the form right down to the bottom. It tells you exactly where to find the information to fill each of the fields. Now, if you're the type of person that you're like, I don't want to watch a video, that's not how you learn well. You need to see something in written script and have all the details. Well, we have an annotated form. That annotated version will do the same thing. It's all written out and it'll show you exactly where to find the information within your EMR or within the form itself, and has samples. So tips. This is a PDF form. So that tip document is also really important. So for example, to fill out that smart form, you need to have Adobe Reader. It needs to be installed on your computers. So go through those tips and make sure you have Adobe. Understand it's a smart form, so when you click on it, you're only going to see the first 4 fields. That's okay, because start populating it and the rest of the fields will start coming up. Going through the COP, you will be reminded about, okay, I have to make sure I know and my team knows what information is shared. So what are the tools that I have to reference? You have your practice facilitator with you as your guide. You'll always have that. But if they're not there with you and you just need a quick reminder, go to the videos. You have that video, it's 4 minutes on how to keep information confidential and the sample of the CED. That's where we hear physicians asking the most questions. So what really am I sharing anyway? And how do I make sure I'm controlling what I'm sharing? Because it's all an automated process. The control comes up with that mapping. So those are the EMR guides. So this is where you even have like simple EMR tip sheets to show you how to enter information in your EMR so you clearly are aware of what you're sharing and what's staying within the EMR. There's actual posters for each EMR that shows you sample CEDs and how they're populated based on the fields in MedAccess and PS Suite and Wolf, HealthQuest, and in Acuro. So those samples are all accessible to you. Thinking about the information that's received. So when you think of the whole CII CPAR process, you're sharing as a clinic, you're receiving for the first time, you're getting that data back in your hand. The bulk of the work is getting the forms in the first place to start sharing and receiving. The receiving is also where you now have a heavy lift. This is that opportunity for quality improvement. So once you're receiving information, we have a post-implementation checklist. So that'll help you walk through and make sure you've done all the things that you need to do. There's a video that goes through, okay, I've got these conflict reports. My panel administrator went in and downloaded them. Now what? The video goes through how you can work through those conflicts. Now we're working also on a more specific slide deck on the how. How do you resolve the conflicts? How do you resolve those demographic mismatches? So that's coming soon. But in the meantime, we've got samples from our PCNs that are already been live. They're already working with their physicians and teams. So remember, Angela said we've got over 1,000 physicians participating today. So we have sample CPAR scripts, and we have that from the North Zone physician teams that have shared that. We have a panel change notification form from Chinook PCN. So they talk about how they've used a formal form when they're resolving the patient conflicts and how they've incorporated that into the clinical workflow. Mosaic PCN has process templates outlining from beginning to end what are the steps to do to reconcile the demographic mismatches, the errors you're seeing in your EMR. Here's another process template that they've developed. How do you resolve those conflicts? What are some samples and ways in which you can do that? Now, for the receiving of information, this is where we really want you to go to the page on our website called CPAR Panel. So you see that on the bottom there, and Kendall has also shared that with you. That's where you're going to get to the nitty gritty, and you can see the actual tools, what you do when you receive the information. So let's go through a sample, a story from North Zone. And this is about how 2 clinics, what did they do when they started to go live on the system, and how did they incorporate the quality improvement activities with their conflict reports? So as a reminder, again, the conflict report is going to show you when there's a duplicate relationship, when a paneled patient had said, yes, this is my primary provider from Clinic A, and they've said, yes, to Clinic B, you also are my primary provider. You see that conflict on the report. Now, Life Medical Clinic is the first one in the town of Whitecourt that went live on CII CPARs for the McLeod PCN. And then we had Associate Medical Clinic come live soon after. And once they came live, you started to see the conflict rates increase on both of their conflict reports. So both of these teams, the way that they operate, they have quality improvement teams embedded within their clinics and physician champions with them. They decided to work together and say, okay, let's make this a quality improvement activity and work together and think about how we can bring down our conflicts. So this is what they did. So Clinic 1 and Clinic 2, they assigned a person within each of their clinics who was specifically going to work on their CII CPAR reports, the things that they were receiving. Here's an example of their run chart. So this is coming from Life Medical. You see that they had 4 physicians. Okay, the colors here represent each of the 4 physicians' data, their conflict resolution report data. So you can see with physician A, when they first started off in participating, they had 246 conflicts. Now they were able to get that down to 100. Now they did that in the first month when they had their staff starting to call patients to resolve the panel conflicts. As they started the process, what they started to hear from their patients as they were going to these both clinics is the patients were saying, why are you asking me this? I'm not comfortable to say who's my family physician. They're both my family physician. I don't understand why I need to choose. It became really clear to the clinic they needed to work on their scripts and they needed to work on it together because the message here needed to be, this is about continuity. It's about understanding who's your family physician that you want that longitudinal relationship with. Who's the one that you want to get the knee notifications when you're in and out of the ER or the hospital? Who's the one that you want to do your screening? And doing that follow up with you. It doesn't mean that you can't go to another family physician if you need to do that. That's your choice. We're just trying to understand who's your primary provider, that quarterback. So they work together on that patient education, that messaging, and that scripting, and then tried again to do the patient phone calls. So working on those scripts, they incorporated that into their PDSA, so that's a cycle of change. And you see when you're looking at their data in the next month, they also decided to have one staff member call making all the conflict reports, conflict calls, and then have another one to do the resolution, to resolve those duplicates. So you can see that conflict rate is starting to go lower and lower. By the 3rd month, they decided, okay, we've refined some of our scripts. Let's look at our processes even further. So they're working with their practice facilitator and they're saying, okay, we'll have one staff now in each of the clinics work together to go through the panel one by one to start to resolve it. So looking again at physician A, 246 conflicts from the beginning. Over 5 months got it down to 5. This is an active process. It's a part of their clinical flow now, and they continue to use this as opportunities to test their tools. So for our next steps, if you're interested in CII, CPAR, what do you need to do? Make sure you know who your PCN contact is. If you don't know who they are, connect with us at continuity@albertadoctors.org. We'll make sure that you are connected. And if your clinic is not a part of a PCN, please go to the CII specialty at albertadoctors.org website. We have a team there that will make sure they can help you. We also have a specialty webinar coming up. That's on April 20th with Drs. Neil Cooper and Scott Wilson. Please, if you're interested, please join this as well. And Kendall has put the link in there also. Thank you so much. Now if we'd open up for some questions. And Kendall, thank you for monitoring the chat. Let us know if we've missed anything.
There's a couple of questions in the chat. The first one was, a clinic manager may fulfill any or all roles. Is that correct? Like the AA, the SL, the PA role? That's question number 1.
It's a really good question, Kendall. We have lots of clinics where the clinic manager, I know you wear lots of hats, and some of you really are the practice facilitator, you're the panel manager, you're all of them. So you absolutely can fulfill all of those roles. The role that you need to make sure you always have a backup for is your CPAR access administrator, and that's for security reasons. So if you are also the CPAR AA, you need to make sure that someone else in your clinic is, and that could even be the physician as a custodian. So again, the purpose is that they need to write on the form that they're approving you to be the one to grant access, and you need to write on the form that you're approving them to give you that access. So it's that security feature of just having the backup. But yes, you absolutely can play all of those roles. What was the other question, Kendall?
And the other question was in regards to, will the AMA and ACT guide or support non-PCN member physicians through the process?
Yes, absolutely. And in fact, I'm part of the team that's doing that. So if you want to reach out to me, you can either come directly to me if you have my email address, or to that CII-specialty at albertadoctors.org email address. We're supporting specialists and non-PCN aligned physicians.
So different teams, but we're all here together. So there was a question about the immunization data that you see in CEDs. So the CED, as Angela went through in that detail, you'll see immunizations. If you're using your EMR to record your immunizations, it will come up in that CED. That's not the same as a new Alberta Health requirement to submit your immunizations through the direct mechanism submission, so that IDSM. That is separate of CII. You still need to do that. I know it's duplicate effort, but that's where we are right now. So that still needs to go up. And if you're having issues or concerns with that, it's important that you contact the eHealth Support Services team, and they'll be able to help you with that. So just so we get that clarity, it is two different systems. Goes again back to when Angela was talking about what eHealth looks like today. We're in that beginning stage of getting everything integrated.
Oh, Terry, I see your question about allied health professionals. Yeah, absolutely. Allied health professionals can be linked up to CII CPAR with consults, but also encounters. So your nurses and pharmacists, et cetera, could be connected into that CED as well. Just got a couple more minutes left. Does anyone have any questions? And please feel free, if you want to come off mute, you can ask a question directly, or if you have more in the chat. But we want to be mindful of your time. So just got a couple minutes left to chat with you.
For those of you that are interested, Angela shared a few stories from our physicians that are currently live on the system, especially for allied health. If you want to hearing stories for them too, come to that physician experiences page. So Kendall's put that link in. It's that's where you're going to hear some more like web podcasts or audio clips, or you actually see some more slides about how we're seeing providers realize those benefits, and their stories are there for everyone to access as well. So while we still have a few of you, and I don't see any more questions, PCN providers submit encounters. Yes, Tracy, absolutely. We've got, actually our PCN managed clinics were some of the first clinics that went live on the system. So the dietitians, nurses, practitioners, they were all submitting and being able to contribute to the patient circle of care there. Because now you could get that information, because really, mostly in NetCare, you're not seeing that from our PCN managed clinics, those multidisciplinary teams, but through this you are.
Sheena, I have a quick question.
Sure.
We have multiple clinics that have physicians that are part of the PCN, but also physicians that are not part of PCN, all working within one clinic. When we're filling out the COP form, does that need to be separated out so that it indicates the ones that are part of the PCN and the ones that are not?
Yeah, that's a really good question. And Nicole, that's super helpful to break it out with that drop down, because this, again, it goes back to the reporting. So the PCNs have accountability to their members to show who's participating in CII CPAR. So they will want to know when the physician is a member and when they're not. So thanks for raising that.
Yeah, you can see on the form where each name goes, there's actually a provider PCN membership drop down as well. So it means that you can put that individual PCN affiliation for each provider.
Perfect. I was just more looking at that PCN affiliate practice, the top portion there, because they all work within the same clinic, but obviously that it is their choice on whether or not they decide to become part of the PCN or choose to, engage with PCN. And we just want to make sure that we're capturing that. So in that case, is that where, like, if that's the case, would you like us to have that separated out for the physicians specifically? Like if there's two physicians within the same clinic that are not part of the PCN, we could do a separate form versus the ones that are part of the PCN that are wanting to participate in CPAR, and then obviously include who their PCN is with.
Yes.
Does that make sense? Like,
yes,
you want it
yeah.
as two separate forms just for ease of clarity there?
Yeah, because I see what you're saying. You can't, the drop down is at the top, right? So when you're going down, but you know what, on the form, it should still below, if it doesn't have it below there, does it have it there? Yeah, it has it right there. So Nicole, does that make sense? You don't need to do the two forms because it's there just as well. Yeah.
Okay,
do you see where it is? Yeah, on part C. So it's on part A. Yes, it's on part A because they're first of all, they're going to do it at the clinic level, the reporting. So that's the part A. But when they're actually doing the count, it's on part C. So thank you for asking that again, because I think I'm hoping it's more clear now.
Yes, no, 100%. So as long as as long as it is listed as Part C for that indication, then you guys are totally fine. That we may indicate that it's a PCN clinic. However, not all members are PCN members.
That's right.
Okay, gotcha. Thank you for the clarification. I do appreciate that.
Anjo, what do you think? I think we have a few of you still here. If you're willing and you're open to it, we'd love to get some feedback. Did we meet your needs? We've adapted this. It's the first time we did it in this way, and if you're open to it, we'd love to hear if it was helpful or not. We will also send an evaluation, so it's an anonymous way to give feedback as well. And please do. We're always changing it up and trying to make sure we're getting you what you need when you need it.
Thanks, Yasmin. And Tracy.
And Angela, I always love facilitating with you, so this was great for us to have this opportunity.
Absolutely.
And Kendall, you're rocking it with the links. Thank you.
Indeed.
Guys,
Hi there.
hi. I just wanted to say thank you. Really enjoyed it. There was some new stuff I discovered this time around. So always love coming and learning from you guys. So have a great afternoon.
You
We
too.
appreciate that, Crystal. Thank you. Thanks, Jen. Thank you, everyone. Have a good rest of your day.
Thanks so much. And we will be in touch with slides and a link to the webinar as soon as that's ready.
I think we're good to turn off the recording, hey?
Indeed.
Okay.